Thank you for having me here. I have been with Five Rivers Health Centers for just under 6 months, so this is a new venture for me. I've always worked in nonprofit, education, service kinds of organizations, but before I start, I want to see a show of hands. How many of you have heard of Five Rivers Health Centers, not Five Rivers Metro? Okay, just a couple of you.
Just through you.
Through me. I'm earning my keep, right? So a lot of people don't know about Five Rivers Health Centers, and we often are confused with Five Rivers Metro Parks. So I like to say we worry about health on the inside, and Metro Parks worries about health on the outside. You can go out and get healthy at their parks. We are a federally qualified health center. So think of community health centers, and that's what we are. We started out officially as Five Rivers Health Centers back in 2011. Prior to that, these clinics and centers were a part of Good Sam Hospital and Miami Valley Hospital. But in 2011, our leader, Gina McFarland L., who is still our CEO, said to the hospitals, you know, we'd like to grow, and we'd like to be able to serve more patients, and we'd like to be able to do it in a much more efficient way. And so we branched off. We became a federally qualified health center. So we received grant funding from the federal government to provide health care to people who are in need. What I can tell you is that our mission is really simple. Our mission is to not turn anyone away, regardless of their ability to pay for their health care. And we provide all of our patients with respect and dignity when they come in. And we also are a training opportunity for Wright State School of Medicine resident doctors. So it's a real win-win for folks, because the doctors that we have our own providers as well who oversee the residents. But those doctors that have just graduated from med school, they have to do a 3-year residency, and so they come to Five Rivers and see our patients, and they're getting that valuable experience before they create a practice of their own or join another practice. And our patients are getting to see young up-and-coming doctors that are up with the latest technology and the latest kind of skills and that kind of thing. So we have 7 locations in the Dayton area, well, Dayton and Greene County area. And so I'm going to pass these around for you. You guys can take one. And this is a sheet that shows our locations. So most of our locations are near or adjacent to Good Sam Hospital and Miami Valley Hospital. So a lot of folks think that we are still part of the Premier group, but we are not. We're a nonprofit and totally separate. We basically pay rental space for the facilities that we're in, okay? So the really neat thing, and one of the many reasons why I decided to join this organization 6 months ago, we have a board of directors, as any nonprofit does, that help guide us and steer us and help us make decisions on how we're going to operate our business. And 51% of our board has to be made up of patients. So when I heard that, I was like, that is an amazing concept, because I've never worked for a nonprofit where the people that you're providing help to are involved in the decision making about, you know, how things are done. So we have 51% of our board made up of patients who are pretty much telling us, okay, this is what works, this is what we want, this is what we don't want, which is an awesome concept, I think. And the majority of our patients are made up of folks who have not had access to health care before. They may be uninsured, they may be underinsured, they may be on Medicare, Medicaid, and we do have some self-pay folks. but we have a sliding fee scale. So if a patient comes in and has no insurance and is not able to get insurance, we work with them to make sure that they can still get the care they need, and we help them to get on a sliding fee scale based on what their ability to pay is, okay? Lately, the question has been, are you closing? Because our main office, our family health center, is located literally right across the street from, bless you, Good Sam at Salem and Philadelphia. And we're not closing. We are staying open, and actually we're going to try to expand our services to make sure that we can meet the needs of the community, and particularly the neighborhood, when Good Sam does close. Now, we don't anticipate that we're going to be an emergency room, and we're not really sure that we should be in urgent care, because what we concentrate on is patient-centered medical care. So we want you to come to the doctor so that you don't have to go to the ER, so that you don't have to go to the urgent care. We want you to have a primary care physician and see a doctor on a regular basis. The other concept, which is really kind of unique for federally qualified healthcare centers like ours, is that we consider ourselves, and we've been certified, as a patient-centered medical home. And it's all-encompassing kind of care. So for example, if a patient comes to us today for a cold or a flu or some sort of healthcare challenge, when he or she is there, we can also say, our dietitian's in today. Would you like to meet with the dietitian and kind of do a checkup on your nutrition and how you've been eating and how you've been taking care of yourself in other ways? We also have behavioral health specialists and social workers at our sites, so that that patient can also talk to a counselor, make an appointment with a psychiatrist if necessary. And so the idea is to provide holistic care, because it's not just about, I have a cold or a flu today. There might be something else going on in the home that we need to be aware of and try to help them take care of that situation. So I think we're the best kept secret in Dayton, quite honestly. We've been doing some focus groups just this week with neighbors in the community to talk about what kind of things do you want us to try to, cover the slack when Good Sam closes. And we're hearing from a lot of folks in the community that say, I had no idea you even existed. So that's why I'm, out there doing the dog and pony show, because we want to make sure that the community is aware. And maybe it's not you. Maybe you have insurance, and maybe you have a great doctor that you have a relationship with, but you may know of somebody who hasn't been to the doctor in years because they haven't found somebody they're comfortable with, they haven't found somebody that'll take Medicaid, those kinds of things. So that's why we want to be a resource for the community, and let people know that we are here and we're not going anywhere, and we're not closing. So I'd be happy to answer questions, and I have just one other info sheet I'll send around. Does anybody have any questions? That was probably way under 10 minutes, Tony.
You still have a minute and a half.
Oh my gosh. What else can I tell you? Yes, sir.
You talked about Greene County briefly. That's relatively new for the organization.
Yes.
You want to tell them a little bit about, so you're covering the entire county from one location.
Right. We partnered with Greene County Public Health, and we are located there in the current public health building right near the Greene County Hospital, but there's a new building being built nearby. So we started providing services in Greene County in April, and they served 1,200 patients or something in that, from April until the end of 2017. The county, I believe, had some clinics, kinds of things that they provided, and it just made more sense for us to partner with them and for us to sort of take over those clinics and provide dental care, primary care, pediatric care, those kind of things in Greene County. So what we try to do is look at areas of our community where there might be a void, and there are folks who need access to health care that don't get it, primary care. And Greene County was one of those examples. We knew there was a lot of folks in need, And so we partnered with the county to say, this is the best way to try to help serve those folks. We're gonna